Not all clients are good candidates for threads. I have a client in her 80s. Threads are going to be very limited value on her because where's all that excess skin going to go? And then I had a patient, I have not heard one complaint from her. And so there you go, just the difference in individuals.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gouw here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. Now, this episode is brought to you by Edna Digital Marketing. To learn more, visit ednadigitalmarketing.com or email us at info@ednadigitalmarketing.com. Now, I have Dr. Melanie Peterson here from Facial Aesthetics by Design, who is a dentist who just couldn't retire and actually got into the aesthetic industry. So welcome, Melanie. How are you?
Thank you. I'm doing fine. Thank you.
Great. Great to have you here on the show. So Melanie, we were talking before, and you actually had a very interesting story of how you actually got into aesthetics from being a dentist. You mind sharing a little bit about that story?
Well, it's kind of interesting because it really goes back several years ago. I went to a continuing education course one night, and there was the plastic surgeon there talking about all the various procedures that plastic surgeons do. And one of the things that he said was that if you are considering having any kind of invasive procedures done, do it by the time you're 50, because if you wait too long after that, it will be obvious that you had something done. And so this way you'll just look rested. And that really stuck with me. So it's interestingly enough, when I got to about 50, I decided I needed to go to a plastic surgeon. and I actually had a procedure done, an invasive procedure, which was an interesting experience. And now that I've gone through that, and now that I see all the different opportunities that are available now, I think it's really exciting that individuals can have aesthetic procedures done without necessarily having to get on an operating table.
Mm-hmm. Oh yeah, it's definitely fascinating. I see people out there in the marketplace where they're like, some of them have in their mindset like, oh, I don't want to do surgery, but some people are okay with that. And like, what are the alternatives? Now, Melanie, you also had someone else who really got you into aesthetics. I mean, seemed like it was the beginning part of how you got interested in it, but there was someone else who got you really into the aesthetics practice, correct?
Well, it was kind of interesting because after I had my procedure done, I went to the plastic surgeon's office for my post-op facials. And the woman doing the facials actually owned her own spa. And so I thought, well, shoot, I've spent all this money having this procedure done. So I'm just going to, continue to see her in her spa to maintain my skin. I never thought about skin. I never thought about sun damage. I never thought about any of that. And she really educated me about the importance of all of that. And I saw her every month for a facial for many, many years. She then retired about 2 years ago. Her daughter, Robin Masters, who is a nurse practitioner, basically took over the spa and is doing some additional medical related things. And one day I was in there and Robin said, I want to show you what fun I'm having. And she brought out all these fillers and things. And she said, you could do this too. And I thought about that. And I said, you're right. I could, because I had just retired not too long ago. Mm-hmm. So I started checking out courses, online courses. That was about the time of the pandemic. Mm-hmm. And so that gave me a good opportunity to spend a lot of time online learning about all these procedures. And I found it really fun and satisfying.
Okay, great. So that's really how you got into aesthetics.
That's how I got into it.
That was the jump. That was the leap.
That was the kickstart. Yes.
Got it. So now that you're actually doing it right now, what are some of the most popular treatment services that you offer, that you do, and what's the reason that they're so popular?
Well, I am in Louisville, Kentucky, which is a little, not quite as advanced as California. And many people here don't know about PDO threads. And the PDO threads really fascinated me from the beginning because they're not really as invasive as fillers, for example, but they do require knowledge of facial anatomy. And, I had gross anatomy as a dental student. So I thought that's a good thing for me to pursue. And I felt like the market would be right for Louisville because there aren't that many people doing PDO threads. And a lot of people have no idea what they are. So that's what I spend most of my time doing, although I do some filler and Botox, and I've also been trained on a Photona laser, which is also fun.
Yeah. Okay. Got it. Now, you're talking a lot about the PDO thread lift. How would you compare that to a facelift? Or people who don't know, you mentioned a lot of them don't know what a thread lift is. How would you compare it to a facelift? Or what would you say to people who are they don't know what it is and they're interested in learning more about what it can do for them?
Well, when patients come into me for a consult, first of all, I tell them that a PDO thread lift is not really a facelift per se. It's more like a procedure that will help you look more rested, make you define your facial features the way they were when you were younger. I do tell people it's very important not to have unrealistic expectations because the post-op period can be not fun. And it really depends on the individual. Some people bruise, some people swell a lot more than others. And you just never know who those people are. So you just really have to spend the time up front with them. The other thing is that sometimes people come in and because of the money, because it's not an inexpensive procedure, they just, I just want a thread here and a thread here. And that's frustrating because you have to just tell them, well, we can do a thread here and a thread there, but don't really expect much of anything because, you have to go at PDO lifts from a lot of different directions in your face to get the result that you want. So it takes time up front to educate clients about that.
Yeah, I think that's very important what you just brought up as far as the education part of it. I think a lot of people don't realize that there's a lot that goes into the procedure, the service, and a lot of them have no idea, and some think they have an idea. And I'm sure that you've had some situations like that where like you mentioned, I want one thread here, I want one thread here, but it's really not going to help them in the end. So I think the way that you educate them is important. And would you say that that's one of the biggest ways you differentiate from your competitors? Would you say there's other factors that differentiate you from other people doing thread lifts?
I honestly don't know exactly what other providers are doing in this area, except from my clients who come in who have had them done before. And they say, oh, well, the person that did this before just put 2 in here and 2 in here, and they didn't go through all this process. I mean, it's important to me to try to get people as comfortable as possible. So as a dentist, I know that people don't like pain. And so I really try to address that up front based on the pain threshold of the individual. And it's so interesting because it's the same thing with dentistry. Some people will just sit there and they don't make a peep. And not only do they not make a peep, but they're really interested in what you're doing and they're curious about it. And I've had people want to look at what I'm doing in a mirror. And those are the best clients. Because they're just really interested. Yeah. And then you have other clients who you look at them and they're cringing. And then some clients look at videos online and, the videos can be a little daunting.
Yes.
And it looks pretty invasive. And so I tell them, it looks that way, but in reality, it's not as invasive as a lot of other procedures like fillers, for example. So it just takes a lot of talking to them up front.
Okay. Yeah. As I've seen some of those videos as far as how it's done, and I'm like, oh, wow. It's like they're calling this not invasive.
I'm never going to do this.
Yeah, so it is very scary. Like when I see videos, when I see pictures of them, I'm like, wow, that seems intense. And so you kind of brought this up, but if you don't mind explaining a bit more about how do you balance between making sure that they're relaxed, they're having a very good experience, but also making sure that from a safety standpoint, also result standpoint, you're able to balance those two pieces into it.
Well, the first thing I do is really being a dentist again, I take a thorough medical history, and I talk to them upfront about the post-op, what to expect from the post-op period, and really not to expect much of anything for 3 weeks, that it can take anywhere from 2 to 3 weeks for that swelling and so forth to really settle down, and that sometimes some people do really well and bounce back in a day or two. It's just an unknown. But again, as a dentist, I'm very tuned into the variability in pain threshold for different individuals. And that's one of the things that I try to ascertain when I talk to the patient is, how do you do at the dentist? Things like that. And sometimes people will tell you, oh, I have a really high pain threshold, and they don't. It doesn't take very long to figure that out.
Yeah.
And I will change the way I get them numb based on their behavior, because if it's stressful for them, it's really stressful for me.
Yeah, I can imagine.
That is no fun. And that is no fun. Yeah.
Okay, got it. Now, I'm sure that must have had some challenging cases in the past. So would you mind sharing just one or two stories about some challenging cases you've had, and basically what that was like, and then how you were able to get through it and in the end achieve a successful outcome for your patient?
Mm-hmm. Well, like anything else, PDO threads haven't been around that long as far as the dissolvable kind, and there's a learning curve to everything, and the only way to learn something is to do it. And so one of the first cases that I did, I realized afterward that I did not spend enough time really forewarning this client about what to expect afterward. And she was and her pain threshold was very, very low. So it was stressful for her. It was stressful for me. And she contacted me several times during that first week because she worried about this dimple and that ripple. And is this going to ever look normal? And et cetera, et cetera. And so, sometimes that can really make you as a provider second guess yourself. And so I reassured her that everything would be fine. And it was. And she came back for her post-op and she was fine. But that was a great learning experience for me to be sure to take that time up front. And not all clients are good candidates for threads. I have a client in her 80s. She has a lot and has lost a lot of weight. She has a lot of excess skin. Threads are going to be very limited value on her because where's all that excess skin going to go? And then I had a patient fairly recently who was so excited about the threads. She was an engineer. She came in, sat down, was asking questions about the whole time I was doing the procedure. And during the procedure, she said, you're really good at this. And I thought, that really feels nice. You really don't she said, you have a nice manner about you, and so forth. And that's always nice to hear that from a client. And I have not heard one complaint from her. I did check in with her the next day and she said, oh, I'm doing absolutely fine. I'm not having a problem at all. And so there you go. Just the difference in individuals.
Yeah. Yeah, and I think it's really important that you have to take into account the personality of your client as well, and that's how you do the procedure. And I think you also brought up a very important point, is that there are some practitioners who think that, okay, there's this one procedure and this is the best one out there, and they try and fit everyone's problem into that one procedure. But you mentioned that, hey, for some people, this just isn't going to work. I think that, as you mentioned before, like that's how you do the education. This may not be the best fit for you. Instead, you should do something else. And I think that's something that's very important in the marketplace out there right now, is how you guide your patients or how you guide your clients, right?
Right. Absolutely.
Yeah.
And
Now,
some patients, yeah, go ahead.
Please go ahead.
Some patients, the shape of their faces, if they have thick skin or if they're too rounded, sometimes they're not real good candidates because it's really difficult to move those fat pads to get the look that they want. So they have unrealistic expectations.
Mm-hmm.
And so sometimes you have to go back and try to put, I have put more threads in people like that just to try to achieve more of what the look that they want.
Mm-hmm.
But it takes more effort.
Okay, I got it. Now, we talked a little bit about some of the tougher situations or tougher clients that you ran into. What would you say for all your happy clients? What's the most common feedback that you get from them?
Well, I think clients that come in and they're excited about having the procedure done in the first place, and they're interested in knowing about it. They're curious and they think it's really neat and they want to watch you do it. Those are the kinds of people, the ones who have really educated themselves. And so therefore they're easier for me to educate and they know more of what to expect. Whereas patients who come in and they really don't know anything about it or very, very little, all they want to do is just look good. They just want instant results. And those are the ones that are more difficult. I find. But it's interesting because I had a client not too long ago who made an appointment for a consult, and she's from South Korea. No, Indonesia. She's from
Indonesia. Okay.
Jakarta.
Uh-huh.
Yes. And she came in and she had all kinds of threads done. And to her, it was just nothing. Yeah. And we just kind of laughed about the fact that people in this country are not that familiar with it. And she's like, oh, well, I've had this done and that done and this done. And it was kind of interesting.
Yeah. Now, and that actually brings up an interesting point. I mean, we have this thread lift procedure, which is quite popular in a lot of other countries, but in the US, it's starting to pick up in popularity, but it's definitely not as big as like a Botox or anything like that. Right. So where do you think the future is for, number one, for thread lifts, but also for just general aesthetic care from the client standpoint? What do you think that's going to be going in the future?
Well, I think as people become better informed about threads and what can be accomplished, I think that they will become more and more popular, especially in other parts of the country. I don't think some people, you're never going to get them to agree to do anything like that. But then there are people who won't do fillers or Botox or any kind of aesthetic procedure. But for those people who want to have something done, but they don't want to have an invasive procedure done, I think that the threads are really, and fillers and Botox offer a nice alternative. And even though they don't last as long as a quote facelifts don't last forever either. And we all continue to age. So just put some more threads in, right?
Yeah. So you think the future of threadlift is very bright then? You think it's going to catch on more and more and more?
I think so. And when people realize what can be accomplished and they see the before pictures and the after pictures, and I get a lot of that. Oh, do you have a before and after picture? And when they see, the jowls are gone, they like that.
Yeah, I definitely see that in a lot of medical practice, before and afters. It's such a key component for how clients make the decision, because they can actually see it. It's not just a intangible anymore. It's okay, wow, like this is what you've done and they're even worse than me. Do you see that happen quite often? It's like as soon as you show them those before and afters, it's almost like a light switches on in their head and like, oh wow. It's like,
that's fun. That's really fun. When you see them look at themselves in the mirror and they're like, oh wow, even with the swelling already setting in. And another thing, how some people like to get brow lifts with Botox, and you can do a brow lift with threads and it will last longer than doing it with Botox. So I think those are fun too. I had a classmate of mine who was complaining about her upper eyelid and how she couldn't see as well because it was falling down. How those sometimes surgical procedures are done for that. And I said, well, we'll just, just put a thread in. And we put a couple of threads in on each side, and she was thrilled. She said, "Oh my gosh, I can see." So,
That's a fantastic story. That's a great
yeah,
story.
yeah. So there are things like that too, that from a functional standpoint can make a difference, not just an aesthetic standpoint.
Mhm. Yeah, that's a really important point you bring up, is that when people think of aesthetics, it's just for the looks. But I think a lot of people overlook it from a functional standpoint, like you mentioned. So
Mhm.
I think for a lot of people, that functional part of it is more than, way so much more than the aesthetic part. It's like it changes something very direct in their lives where they can function even better in their life.
Yeah.
So, but thank you for sharing that, Melanie. I have
Mhm.
one last question for you, but before I ask that, I just want to point people to your website, which is www.facialaestheticsbydesign.com. And the last question is, what would you say is the most important piece of advice you can give to somebody who's thinking about getting aesthetic services, maybe let's say a thread lift, but something is stopping them? Maybe it's the fear, maybe it's the money, maybe they just don't have enough information. What would you say is the most important piece of advice you can give to somebody like that who's on the fence?
Well, it's interesting because I do get clients like that. And, I go through and explain the procedure to them. Sometimes I will say, well, if you want to do this piecemeal, we can do it piecemeal, as long as you understand that you're not going to have the result that you may expect or want with just one session, because it takes several different sessions to accomplish what we're trying to accomplish. So a lot of times I will give patients that alternative. I also accept care credit for some patients who want to put it on a payment plan,
Mhm.
right? So I will offer that, because I realize that it's a big chunk for people, and they've got to really, really want it.
Mhm.
And for them to really want it, they need to understand what it can do for them and understand what the procedure is.
Got
So,
it. Got it. Well, there you have it. Dr. Melanie Peterson of Facial Aesthetics by Design, sharing her expertise with all of you. Now, Melanie, where can people learn more about you or contact you?
people can contact me by calling 502-500-8187.
Okay.
I will be happy to provide information. It's interesting because I am doing this because I am choosing to do it. I like the flexibility of doing it, when I am available to do it. But I do accommodate clients and see clients whenever they want to be seen, even after hours.
Yeah.
So, I actually rent space from Robin Masters. And we tag team each other and refer patients back and forth. So that works well.
Yeah, sounds like you have the perfect setup for what you're looking for, your lifestyle. Perfect
Yes.
working lifestyle.
Yes.
Great. Well, thank you for being on the show, Melanie, and thanks for sharing your message with the world.
Thank you. I enjoyed it.
Great. Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.